Good evening, everybody. Welcome back to our live discussions on Wednesday evenings. And tonight I have the privilege of introducing you all to Dr. Alan Christensen, known as Dr. C. So I hope you all had a wonderful New Year's and Christmas holiday and that you are ready for this new year, looking forward to how to improve your health because there's always hope for healing. So let's invite Dr. Christensen and then we can just start our discussion. Hello.
Hello.
It worked. I am so thankful.
Mostly worked. There's part of it blocking my screen. So, well, that's fine. I can see well enough. If we're on, yeah, good to connect.
Yeah, can I ask you maybe to just lift your phone a little bit? We can only see your mouth.
Yeah, it's kind of odd. I've got the,
Oops. Okay, let's try again. There we go.
okay.
That's fantastic.
Yeah. I've got a glitch on my end. It's the request to go live is covering my framing, but I can see you fine. And if my framing is decent, I'm good to go.
You are perfectly in frame. So thank you so much, Dr. C, for joining us tonight. I'm looking forward to this discussion. And I think everybody that is going to view this is really going to benefit from all your knowledge and experience. So we are all looking forward. So I would just like to quickly introduce you. So, guys, I would like to introduce you to Dr. Alan Christensen, a naturopathic medical doctor with over 30 years of experience as a naturopathic endocrinologist and a thyroid health specialist. He is also a New York Times best-selling author of multiple books. And the books that he has relating to thyroid is Take Charge of Your Thyroid Disorder, The Thyroid Reset Diet, Healing Hashimoto's, Complete Idiot's Guide to Thyroid Disease, and Hormone Healing Cookbook. There is other books as well, but these are the ones referring to thyroid conditions. So, Dr. C, I would love for you to tell us a little bit more about yourself. This was just a short introduction, nothing that can do you justice. So tell us a little bit more about yourself and why is thyroid your passion?
Yeah, thank you so much for that. I'm someone who got very into health and wellness for my own purposes. I had struggles as a kid with epilepsy and obesity. And I don't know, I stumbled into a whole lot of health books and read them and learned things and gradually made more changes. And it was just so life-changing. It was just transformative. And I realized, just as a kid finding information, how big of a deal that was, how much of a problem there must be, and how many other people must have been held back from not feeling their best for things that didn't have to be. So it became a real passion for me natural medicine became a big passion overall. And in my training, I saw that with thyroid disease, it was really on the rise then. It still is, but it's really just picking up then. And there was a big gulf between how it was seen in the conventional worlds and the alternative worlds. And it seemed like I don't know, I wanted to not so much meet in the middle per se, but I knew there were some common truths from both sides. And also there was more to understand that both sides weren't talking about. So yeah, I connected with some people who were struggling with it, and I saw how, simple changes can make a big difference for them. And that was about 30 years ago, and I've been at it ever since.
Wow, fantastic. Well, thank you so much. So tonight I have a list of questions. Unfortunately, you are coming blind into the discussion tonight. Normally I send the list of questions in advance. I unfortunately did not have the time.
That's okay.
But I'm trusting with all your experience, you'll know exactly all the answers to my questions. So what I usually do is I start off with the basics just to form a foundation for our discussion, and then we get into other things. Please feel free to share as much as you want to. The night is yours, on your side, the afternoon. So I would just like to have a discussion where when people watch it, they will feel they walk away empowered, how they can approach. And then afterwards, we can just advertise your books once again. If you have the books with you, you can show them so people can get familiar with them, know what to look for. And yeah, so I'm going to start off with a question. What is the function of the thyroid?
Yeah, three big things. It controls how well the body converts food into energy, and it controls how well we repair connective tissues, skin, hair, nails, tendons, ligaments. And then it controls how well nerve signals move throughout the body. So your brain and your physical movement. So a little gland that does those main three things: energy production, tissue repair, and then nerve conduction.
Okay, thank you. So, okay, and then second, what I would like to ask is, what are the thyroid hormones in the body and what are their purposes?
Yeah, well, there's about a dozen and a half different biologically active thyroid hormones. We call those thyronomines. And we know a lot about a few of them, and they work in concert. The main ones we think about are T4 and T3, sometimes T2, and basically they do those three things. They change the amount of metabolic rate, they speed or slow it. Same thing for tissue repair and nerve conduction. They basically either make those things work more quickly or more slowly. And this is done globally, so throughout the blood supply, but each part of the body is a collection of different tissues that have their own localized ecosystem. So thyroid hormones are used differently in the brain than they are used in the liver or elsewhere. So yeah, there's many examples where they're used differently from one part to the other. But overall, they're controlling those main physiologic processes.
Okay. Okay, and I think when we talk about thyroid hormones, when people go for test, I think the ones that everybody is familiar with is thyroid stimulating hormone, T4, T3, and then there is free T4, free T3, and then reverse T3. And when people go for antibody test, it's the anti-TPO, correct? Yeah. So, can you just talk about a little bit about the relationship of these hormones and how you know exactly what I asked. So just talk about the relationship and how they affect each other. And
Sure, sure. So the thyroid gland is one of many parts of the endocrine system, and as such, the endocrine system is controlled by the brain and by more glands. So within the brain, we have the pituitary and the hypothalamus. And the hypothalamus is the overall, think about it like the CEO of a corporation. And the pituitary is like a manager. It's got particular duties and it collaborates with particular staff in the corporation. So the pituitary controls how much the thyroid is working by thyroid stimulating hormone. And in this model, if a gland is not told to work, it'll slow down. So they only do as much as they're told to do. So yeah, the first step is pituitary releases TSH, and that has the thyroid produce more hormone. The thyroid releases T4, a little bit of T3, and these are also circulating throughout the body, converted in many ways and used locally. Reverse T3, just to touch on that briefly because you mentioned it, most T4 is made into a thing called reverse T3. That's more like 60 to 80% of it. And it's a storage hormone. It's a way that we can have hormone that it's a type of redundancy. You know, we've got two kidneys. We don't need all of them. So we make more than we need. So if we need more, we've got a backup source. So that's one role of reverse T3, but it's also needed in the brain. So reverse T3 is important for other reasons all by itself. So yeah, T4 is the main one that comes out. T3 is the one that a lot gets made into. T4 is important by itself too. It does some things that T3 can't do. So they all have various roles to play. Now, the thyroid, we can think about its function, you know, how much is coming out of it, the various levels of these hormones, and also then about any autoimmune responses, if the body's attacking it or not. So you mentioned thyroid peroxidase. So yeah, anti-thyroid peroxidase, anti-thyroglobulin. These are two measurable antibodies that correlate with an autoimmune attack against the thyroid. Interesting point. About half of people with autoimmune thyroid disease never have measurable antibodies. That's often kind of surprising. But yeah, that's what those things you mentioned. That's a quick note about what they mean.
okay, wonderful. Thank you so much. Okay, and so from a functional perspective, what are the optimal levels of these hormones? Because I know that the standard reference ranges and the functional ranges are different.
Yeah. Yeah, so in functional medicine, there's times in which many have taken lists of normal ranges and just made mathematical averages of them and argue that you're
Okay.
better off to be mid-range. And I
Okay.
don't know, I don't find that very compelling. In
Okay.
the case of thyroid hormones, there is good evidence that uh, some populations do better at certain parts of what's called the normal range. So, for
Okay.
example, if somebody needs thyroid medication and they're on a certain amount, they may not have full control of symptoms unless their TSH is on the low side of normal. There's really good evidence about that. That's pretty solid thing to say. Where that gets confusing is many in natural or functional medicine will hear that and say, oh, everyone's got to have a TSH up here. And if you don't, you
Okay.
need medication.
Okay.
Or if you don't, there's a problem. Maybe, maybe not. So yeah, there's some general things that can be said, but a lot of the ideas about the optimal ranges are they're just average. There's middle averages. And
Yes.
there's many ways by which healthy people can have a certain range of thyroid function, and that's okay. And then also
Okay.
that differs with pregnancy or different disease states or
Yes.
ages. So yeah, there's not really a perfect narrow range that's best for everyone. And then the other thing to mention is that the variation of thyroid levels, despite symptoms, is quite broad.
Okay.
So many people have abnormal thyroid levels and they feel fine.
Oh, wow.
And many people are totally
Okay.
symptomatic and they have, well, so to go back on that, there was a big study taking people in a community and doing thyroid tests and doing very detailed symptom questionnaires. And
Mm.
there's stages of hypothyroidism. This is focusing on low thyroid output. The worst one's called overt hypothyroidism. That's where the
Okay.
TSH levels are way above normal, typically above 20, and T4 and T3 are way below range. Now, in those with overt hypothyroidism, 17% had pretty classic thyroid symptoms. 83% had none. 83%
Wow.
felt fine. And
Wow.
now, if you flip that and you say, of people who have thyroid symptoms, how many have a low thyroid? Most don't. so, so
Okay.
yeah, autoimmune thyroid disease can cause symptoms regardless of thyroid levels. So yeah, so thyroid levels are important and they're good to be aware of, but there's not really a perfect range for everyone. And
Okay.
they relate to symptoms, but often in ways that are much more loose than you might expect.
Okay. Okay. Well, that is really interesting and insightful because, I mean, I tend to follow more of the functional medical doctors than conventional medical doctors. Well, it depends on what their specialty is. Um, and I've heard so much, that the conventional ranges, there is too big of a gap. And some people is at the lower end of normal and some people is at the higher end of normal. And that's why it's finding that midway tends to be um, a better number to look for.
Yeah, in the
But yeah,
case of
like
in
you
the case
say,
of
it's not necessarily the truth.
well, the bigger discussion that I love to have is because so often in whether it's natural medicine or conventional medicine, the discussions about normal ranges become discussions about whether someone should go on medication. The
Yeah.
conventional doctors are quick to use one type of medication.
Yes.
The natural doctors are quick to use other types of medication. But it's still the thought is still, oh, if your levels aren't right here, medication's the best solution for you. And yeah, there's more evidence now saying that in rare circumstances, that's totally true. Like if someone has overt hypothyroidism and nothing else helps, or their thyroid is taken out, or it's been ablated by radiotherapy, totally true. But most other versions, even of pretty severe thyroid abnormalities, there's not more benefit than there is harm from medication. So yeah, I think a lot more about how naturally can the body normalize these levels. There's good evidence that most don't need medication. Medications, it's been argued that over 90% of those on thyroid medications are put on them unnecessarily. And as such, that raises the risk for bone thinning, heart disease, and about 15 different types of cancers.
Wow. Yeah, I've recently watched some of your reels that you've shared where you specifically mentioned that most people that are on thyroid medications is on it unnecessary, and it is more valuable to look at diet, lifestyle interventions, and a whole bunch of other things, maybe supplementation here and there, in order to help the body to reach its optimal function in this regard. So I found that specifically interesting because most of what I've researched over the years when it came to thyroid is that you need medication when it's this, or you need medication when it's that. And I've had so many friends that was on thyroid medication, and most of them said, they don't really feel better, or it doesn't make a difference, or they constantly have to up their dose, or something
Well,
like that. It's so yeah. This is
well,
why I wanted to invite you, because you look like somebody that wants to bring the perspective, which is my heart, the hope of healing,
yeah.
and that there's hope in the natural way of addressing a specific health disorder. And so, yes, please do share as much when it comes to the natural perspective to empower people to find that solution for them.
Well, and the tricky thing too is that there's many in natural medicine who mean well, and in their minds, if they're giving a prescription medicine that contains the same hormones the body would make, that's a natural treatment. And whether you want to call it that or not, I don't care about definitions. You can define things different ways. But the data shows that when someone is taking a thyroid hormone from outside of their bodies, even if it's a natural type, even if they have healthy blood levels, they have a lot of medical risks. And when large populations like that are looked at, as a population whole, they don't feel better, they don't have lower disease risks, they don't have a lower chance of other thyroid problems. So it's really not of net benefit. And many in natural medicine, their patients are doing several things at once. They're doing diet changes, they're taking supplements. So people definitely sometimes will go on thyroid medicine and feel better. But when thyroid medicine is the only variable, it doesn't really help. So
Yeah.
it's hard, it's confusing to see someone feeling better from doing many things, from which thing was helping the most.
Mm.
And yeah, the body has much more of a chance of healing and recovering than we thought before.
Okay, well, I would love to get into that. So, okay, my next question would be, okay, I'm going to skip that one. So, what is reverse T3 syndrome?
Well, yeah, there's a real phenomena when someone is sick that their body may convert a higher amount of their thyroid hormones into reverse T3. This is called euthyroid sick syndrome or non-thyroidal illness syndrome. And it's most been recognized in intensive care units. So if someone's in the intensive care unit because they have septicemia, they've got a bloodborne infection, or their heart is failing, or their kidneys are giving out, it's not uncommon to see that they have some type of unusual hypothyroidism. Their TSH may be low and their T4 is quite low and their reverse T3 is really high. So what's going on is their brain is not asking their thyroid to work, and what is being made from the thyroid is mostly being converted into less active hormones. Now, for a lot of years, the question has been, is this an accident? Did they get sick and did that hurt their thyroid? Or is this the body trying to protect itself? Is this the body trying to slow itself down and be gentle because there's a problem? One analogy I've thought of is that if your engine light comes on in your car, you're probably going to drive gently to the next mechanic. You're going to be careful, right?
Yeah.
So they've looked at this, and the most direct way to answer that question is just to say, well, let's take people and let's have one group take thyroid medication and achieve normal levels again, and compare that against another group who does not. And so if you take someone who's like that in the ICU and you give them thyroid medication, they don't have better outcomes. They're not more likely to live longer. So our best guess is that it's an adaptation. It's not a mistake. So that's what we know mostly about reverse, what's called non-thyroidal illness syndrome. Now that idea has been taken in natural medicine and broadened, and it's been tried to be applied to pretty much everyone. So yeah, many people have levels of reverse T3 that are flagged as high. And then many will say, oh, but if it's high, if it's above here, or if it's high, if this ratio is off, or something or the other. And in truth, many people who are perfectly healthy and have no problems will have high levels of reverse T3. There's also an argument that somehow reverse T3 blocks thyroid hormones, or that it makes your body unable to use other thyroid hormones. This has been studied. Back in the 70s, people were given intravenous doses of reverse T3. They were given it from outside their body. And that was watched to see how that affected their other thyroid hormones. It doesn't block them. It doesn't block T3. It doesn't cause symptoms. Now, there are many examples of people who are very sick and they have high levels of reverse T3. They're not sick because they have high reverse T3.
Okay.
They're sick and their body is trying to calm them down. When you're sick, you're often more tired. It's better to
Yeah.
rest up and let your body heal itself. So reverse T3 is one more way of making your body do that. There certainly are times to where healthy people have high reverse T3. And then another common thing, if people are unnecessarily medicated or overly medicated, they might make a lot of reverse T3 trying to protect themselves against that.
Oh, okay. Well, thank you for that. Yeah, that was very interesting. Okay, so what is subclinical hypothyroidism?
Yeah, so this is a defined phenomena, and sometimes in natural medicine they'll talk about this in a different way. They might talk about someone who has symptoms of thyroid disease but normal blood levels. That's a real phenomena, but subclinical is already defined differently. So subclinical is defined as someone who has an elevated TSH but still normal levels of T4. They could be low, but they're still being made.
Mm,
So the threshold of TSH, there's a few different guidelines. Some will say that between 10 to 15 is a gray zone. In most cases, 20 is a common upper limit. So regardless of T4, if TSH is well above 20, sometimes that's then called overt hypothyroidism. So yeah, subclinical, the TSH is elevated. It's above range between 4.5 and somewhere around 20. T4 is still being made. Now, this is where most people in the conventional world are put on thyroid medication. And we thought for quite a while this was an early slowing of the thyroid. But the data now shows clearly that if you take those people and put them on medication, they're not healthier, they're not at lower risk for thyroid problems, they're at higher risk for other medical problems. So there's been many, many papers looking at millions of data points of people saying we shouldn't be putting these people on thyroid medication. They may have symptoms, and their risk of their thyroid slowing is a little higher than it would be otherwise. By a little higher, if you take a group of adults, you've got about a 1% chance of overt hypothyroidism, of their thyroid really slowing. If they have subclinical disease, that risk is about 4 to 6%. So the other
yeah,
way of saying that, somewhere around 96 to 95% of people with subclinical disease aren't going to ever have a problem. The thyroid's never going to
yeah.
slow further. Yeah, so it's basically a high TSH. And in many cases, it's just a random one-time finding.
Oh,
40% of the time, if you do nothing at all, but retest within 3 months, it'll be fine again. So
okay.
yeah, subclinical hypothyroidism. And there's also talk about relabeling it because just the label itself
Mm,
makes you think that there's too little thyroid hormone coming
yeah.
out. It's
Yeah.
actually not hypothyroidism.
Okay, perfect. I want to check something with you. A couple of years ago, when I had some concerns, which all directed in the hypothyroid kind of symptoms. I mean, Dr. Google was there for me. And so when I went to go do my blood tests, afterwards, I went to go do some research because my doctor couldn't give me answers. Everything was in a range, but I had all the common symptoms relating to hypothyroidism. And I found a method to calculate if there is a imbalance. So I just want to check with you if this is something that you are familiar with, and maybe you can explain exactly how this works. So what this, I don't even know where I found the information. It's too long back to remember where I found it. So what it said is you need to divide your free T3 with free T4. And then the answer that you will get, if it is below 2.75, 2.75 being baseline, if it is below 2.75, it can indicate subclinical hypothyroidism, a selenium deficiency, disrupted deiodinase activity, but this specifically is when the results are between 2 and 2.74. If it's below 2, the answer that you get when you calculate, if it was below 2, it indicated the low T3 syndrome. Is this something that you are familiar with?
Yes, very familiar with it.
So is it something that is valid? Is it something that one
No,
can use?
no,
Okay.
no. The T3 and T4 mean nothing by themselves. It's impossible to make sense of them without looking at the full context. So they're hormones that are highly buffered by the body. So an example could be serum calcium. Someone might drink a gallon of milk, right? Their serum of calcium levels probably won't go up. And that same person could take maybe a few months of consuming very little dietary calcium, like no dense sources of calcium. Their serum calcium levels are almost never going to go down. So what happens is that when you consume a lot of it, your body stores more and excretes it faster. If you consume very little, you'll draw out of your bones and elsewhere to keep it steady.
Yes.
Now, it's the same for T3 and T4. Your body has a set point it chooses for T3 and T4, given all facets of your health. Now, when someone has their thyroid taken out and they're given no medication, the body can't compensate anymore. And eventually T3 and T4 go way below range. Or on the other side, if someone has Graves' disease and they're not managed, they're not treated, there's eventually a point at where they can't block or excrete thyroid hormone quickly enough, and T3 and T4 go way above range. So those things are simple excess and deficiency. But between those situations, T3 and T4 are at a set point. So the body chooses them. And doctors don't understand that. They think that the body needs more of one or more of the other, less. Well, it's choosing that. So it's taking into account all factors of your health and then putting those there for that reason. Now, you may not be at a perfect state of health, and it may be the case that there's a lot of things your body is compensating for. One small example, if someone is on a extremely low caloric diet, their T3 may go way below range. Now, that doesn't mean they have thyroid disease. That doesn't mean they need to take T3 medication. It just means their body's responding to a starvation state by slowing basal metabolic rate. That's one tiny specific example. But your T3 and T4, assuming that your body has some control over thyroid function, that they're kept in a range based upon your current best needs.
Okay, well, that's fantastic. Thank you. Okay, so now I want to get into what is the role of the liver in thyroid function. So, yeah, let's start there. What is the role of the liver in thyroid function?
Sure. So a lot of bi-directional interactions between thyroid hormones and the liver. The thyroid hormones control the rate that the liver is burning fuel, storing fuel, making many proteins. And then also we know that if thyroid hormones are not ideal, or if there's thyroid autoimmunity, then the liver may be more prone to have fat buildup, or it may be prone to have a problem in balancing biochemistry in certain ways. So yeah, a lot of interactions back and forth.
Okay, can liver dysfunction reduce or increase the enzyme deiodinase production, which will then result in thyroid hormone imbalances?
Well, yes and no. So when the body, back to like the starvation example, in cases of fatty liver, that will downregulate the conversion of certain thyroid hormones. So again, this is all done as part of the plan. The body is compensating. And in many cases of liver disease, there will be changes in compensations in thyroid hormones. And many of those are mediated via deiodinase enzymes. There's a lot of other mechanisms. We collectively call all of these things peripheral metabolism. So with thyroid hormones, we have central control and central metabolism, which means how much comes out of the thyroid. And then we have peripheral metabolism, which is all the ways in which these hormones are used and managed outside of the thyroid. And of those many control mechanisms, deiodinase enzymes are among them. So yeah, there's many times in which the liver is not working well, that the body creates a different balance of thyroid hormones because of that. It's not so much that the liver is making something happen that the body doesn't want to happen. It's more so that the body is compensating for this state.
Okay. Then, question. What nutrients are essential for both the production and the activity of the enzymes that is activating T4 into T3?
Yeah, many are. There's about a dozen that are relevant. Among the most central would include selenium, iron, zinc. There's some of the big ones. There's an inverse relationship with iodine. When someone's at a state of iodine excess, that actually creates more work for deiodinase enzymes. So that one is essential, but at excess, it can actually make things not work as properly.
Yeah, I would love you to get into that specifically a bit later. But yes, that is a topic I would love to discuss on the excess. Okay, so selenium, iodine, and iron, are they mostly responsible for the activity of the enzyme?
So defects of deiodinase enzymes are not big reasons for thyroid disease. I'll just say that
Okay.
right now. That's not like the main reason most people have thyroid problems.
Okay.
So yeah, those things are all relevant to how these enzymes work, but these enzymes aren't really broken in nearly all cases.
Okay, so there isn't, like, if you have a deficiency, let's say in iron or iodine or selenium, that you won't maybe not produce sufficient amounts of these enzymes to activate
If you're
T3.
deficient in a nutrient, that's a bad thing for a lot of reasons. But
Mm-hmm.
yeah, defective deiodinase problems can be relevant for those who are on medication, especially T4 only, and the body can use them better. But yeah, as far as like drivers of thyroid disease, it's not, the enzymes aren't the problem in almost all cases.
Okay, that's good to know. All right, I want to talk about the lymphatic system's role in thyroid. Um, so, what is the role of the lymphatic system in thyroid disease?
I'm not really aware of a very relevant one, in all honesty.
Oh, okay. So I'm going to tell you what I researched, and I came to um, somebody that is in Ayurveda medicine, and he specifically spoke about the cervical lymphatic congestion that is around the thyroid. And as the thyroid is supposed to, release everything that needs to be released and drained from there, all the waste products, if it gets congested, it can get inflamed and then in turn affect the thyroid. Is that something that you are familiar with?
No.
Oh, okay. Okay, so I'll skip that. I'll skip that then because there will be no use
That's
in
not that's
discussing
not
that further.
that's not come up in the last 30 years of research. There's no published literature on that.
Okay.
Yeah.
All right, perfect. No problem. Okay, so and the role of gut health, and I think this is the area that plays a big role when it comes to thyroid as well, because I mean, at the end of the day, the gut is related to everything because it needs to transport all the nutrients from there. So, talk to us about the importance of good gut health and the absorption of nutrients and everything, and how that can affect or slow down thyroid function.
Yeah. And I guess I should back up a step. There's different ways of approaching the problem of figuring out what causes thyroid disease and what can fix it.
Okay.
And one way is to look at all these possibly connected biochemical pathways. And early along in my career, I found that really alluring, but I also found it, I don't know, uh, like you could chase your tail forever. You can
Yeah.
speculate anything you want. You could say anything could do anything. So I put a lot more focus on empirical evidence, like what actually works for people.
Okay.
So the body's a complex system, and you could say this could do that, this could do that. You can make a good reason for it. It may or may
Yeah.
not be true. And we
Okay.
only know what works when we see large groups of people that go through something and did that help them or not. So
Okay.
there've been only a couple of studies doing things to help gut health or doing probiotics and seeing if that changed thyroid disease rates. It's really not made a big difference. You can make a lot of arguments why it might, but so far the few studies have been done have not showed a big effect. Now, many have said they've done various gut health protocols and some have done better. That's totally fine. What I'm interested in is what can work in a controlled setting. The tough part is that people on their own often do many different things, and a certain number of people will get better just randomly. There's no way around that. So I'm happy when someone gets better, but I want to know what's most likely to work. So I focus hard on good studies using sick people and seeing if something works for them or not.
Okay. All right. So then I'm going to turn the question into, how do you most of the time approach somebody to support them increase their thyroid function naturally?
Yeah, so thyroid disease, there's countless things that can contribute to someone's risk, but there's four factors that cause thyroid disease. There's only four. Many talk about longer lists, but they're really the largest studies have said there's four causal factors. There's genetics,
Yes.
And this is the biggest single one. So if you're an identical twin and your twin has thyroid disease, your odds are over 70%, no matter what else you do. So this is largely a genetic disease. Now, age is a factor. You know, if there's some way you're prone to have it happen, the more years you live, the more likely it is to emerge. Gender is a factor. Gender somewhat overlaps with genetics. So women have two X chromosomes, men have one. Most of the things that affect this are in the X chromosome. So far, these things still relate. And then finally, iodine status. Are you exposed to way too much, way too little, or changing amounts? Now, the high level story with thyroid disease is that humans are adapted to two different ecosystems, coastal or inland. And so coastal adaptations, and this goes back to the deiodinase enzymes, coastal adaptations allow humans to do okay if they occasionally have a lot of iodine. Inland adaptations allow humans to do okay in a consistently low iodine environment. Now, we don't have both, we have one or the other.
Yeah.
And in the modern world, somewhere around 20% of people have these genetic adaptations to inland environments. And now in North America, some recent stats, about 30 to 40% of people, based on age, gender, socioeconomic status, are consuming amounts of iodine that are problematic if they have those inland genes. So yeah, so some people don't genetically tolerate even a high normal intake of iodine. And as far as those four causes, genetics, age, and gender, can't do anything about those.
Yeah.
So the one cause we can control is our iodine status.
Mm-hmm.
And there have been studies in which the only thing done has been to control iodine intake and get it to a low range. And doing so has been shown to reverse thyroid disease, autoimmune, Hashimoto's, even overt hypothyroidism for the majority of adults.
Wow. Okay, so on the topic of too much or too little iodine, I found online also there's a lot of controversy around that. So when is it too much? When is it too little? And how do we know through our diet if we get too much or too little?
Yeah. So very different questions, good questions. Now, it also depends upon someone's proclivity towards thyroid disease. And we know the genes involved, but it's really not that helpful to go. You can go look at 23andMe and see which ones you have. It's not even which genes you have, it's how they're acting. So basically, if you have thyroid disease or a lot of people in your family have it, you should assume you're prone to it. And the World Health Organization has shown that those who are not likely prone to thyroid disease on occasion can safely consume up to about 1,100 micrograms per day as an upper limit. Now, in populations, when a population's intake exceeds 200 micrograms, the rates of thyroid disease start getting higher, especially in those prone to it. So a safe upper limit is somewhere around 200 micrograms for someone who might be susceptible to thyroid disease. And in terms of knowing how much you consume, it's a hard one. Many nutrients are hard to get exact tracks on the intake, both in terms of labeling or food lists or even tests for our body's levels. The best way to know is really being aware of categories of food and their typical amount of iodine per category. When I wrote the Thyroid Reset Diet, I put foods into three categories: the green light, yellow light, red light. And basically, if someone's trying to not go above 200 micrograms per day, all the green light foods are fine, and they can do one or two servings of yellow light foods and do okay with that, assuming they're not getting a lot of iodine from supplements or medications or personal care products. So yeah, so about 200 is the safe upper limit.
Okay, fantastic. I think here in Germany, what I've read somewhere is that their daily recommendation is 150 micrograms per day. Is that towards the lower side, or is that also what you would recommend?
Yeah, so total intake for all sources, for most people, that's reasonable. Usually ranges are given. So yeah, so that for total intake, that's not a bad thing for most people. But those prone to thyroid disease, the further they get above 200, the more likely they are to have problems. Now, if someone has developed thyroid disease, they can benefit by temporarily going below 100 micrograms for 3 to 6 months. And that's what the Thyroid Reset Diet explains how to do.
Okay. And if you refer to thyroid disease, is that specifically like Hashimoto's and Graves' disease, or is that also including just regular hypothyroidism?
Well, funny thing, basically, yes. Most hypothyroidism is Hashimoto's, nearly all of it is. Again, somewhere around half of people with Hashimoto's don't have positive antibodies. So
Yes, you
yeah, even if
mentioned, yeah.
someone does an antibody test and they're negative, doesn't mean they don't have Hashimoto's. Yeah, so
Okay.
hypothyroidism, Hashimoto's, subclinical, suboptimal. Uh, as it's an adjunct for treatment with Graves' disease as well. It may not be a standalone treatment.
Mm.
For all these others, it can be a standalone treatment for most people.
Okay. And how would you treat grave disease differently from Hashimoto's? I mean, they're completely opposites, but I mean, it's still the same hormones that are in play. So I would assume there's a slight difference in approach.
There is, and yeah, funny thing, they may not be a different disease. There's talk about recategorizing them because
Oh,
they share many elements of the same autoimmunity, and they're actually quite similar at a molecular level. So yeah, most cases, Graves results in hyperthyroidism. Hashimoto's, for a subset of people, it may cause hypothyroidism. Important point, even when Hashimoto's doesn't cause hypothyroidism, it can still cause symptoms and problems. So that's a brief sidebar. So yeah, so approaching those, the mainstay of treatment with Graves' disease is just slowing the thyroid again. And for some people, just getting a low enough iodine intake by itself may help with that. Others also need medication short term. Some need surgery, some need radioablation. But many can do fine just by either diet alone or diet with medication. Now, Hashimoto's, if we pull it apart from hypothyroidism, it's not a lack of thyroid hormone, it's an autoimmune response. And the antibodies you mentioned, antithyroid peroxidase and antithyroglobulin. So thyroid peroxidase, that's the enzyme that oxidizes iodine. Thyroglobulin is a protein that stores iodine. So when you lower the intake of that, your body quits attacking those things. So yeah, the
okay,
best first line treatment is simply lowering iodine intake for that.
okay,
But
okay.
Hashimoto's, just to back up a step,
Mhm.
the autoimmune side is not benefited by thyroid medication. Thyroid medicines don't help Hashimoto's disease.
Very interesting. Um, okay, so obviously Hashimoto's and Graves' disease are related to the immune system. And so the immune system, how does it, what goes wrong for it in order to trigger the Hashimoto's or the Graves' disease? What is the common denominator between with people who actually, I mean, the immune system can trigger one thing in one person and something in another person, but what is it that would cause it to trigger Hashimoto's or Graves' disease?
Yeah, typically the first event, when you look back at someone who's had either disease and you track their history and track their levels when available, the first step is autoimmunity against thyroglobulin. Now, thyroglobulin is the protein that stores iodine within the thyroid. And ultimately, that protein folds and binds and connects itself in ways that form the active thyroid hormones. You know, T3 and T4, the 3 and 4 are iodine atoms in a certain molecule. This is what those numbers mean. So, what happens is that the thyroglobulin molecule has 13 tyrosol residues onto which iodine may attach. If a person exceeds their personal iodine tolerance for too long, one or two things can happen. One is that if they exceed it rapidly, their thyroid may shut itself down to prevent extra hormone from being made. That's called the Wolff-Chaikoff effect, and that's why high iodine can cause hypothyroidism. Now, if their intake is longer and ongoing, that may not suffice, and excess iodine might enter the thyroid. In those cases, it's associated with thyroglobulin, but not in the right places on the molecule, not on those 13 tyrosol residues. When that occurs, iodine is a source of free radicals. That's why iodine's an antiseptic. That's why it kills
Mm.
infections. So those free radicals start to damage thyroid proteins, and they also recruit the immune cells. They trigger the lymphocytes to start attacking some of these structures. Your immune system treats
Okay.
this as foreign because of the oxidative stress. So that's the earliest stage of onset, both for Hashimoto's and Graves' disease.
Okay, well, that's interesting. Thank you. I didn't get time to look into that, so yeah, that's interesting. Okay, so the role of nutrients in thyroid function. So there is a couple of nutrients that they say is essential for thyroid function, and I mean we all know the common ones is selenium, iodine. And then iron, zinc, vitamin A, vitamin D3, omega-3, especially from fish oil, and then amino acids, which must come through sufficient protein from the diet. Is there anything else, or is there like specific amounts that you can recommend that people need to get in at least daily or every other day to make sure that these nutrients are sufficient through diet
So I guess
in order
I guess
for thyroid function?
I guess the question, we can often see how a certain nutrient plays a role in the body for something. From there, it can be tempting to assume that therefore, whenever there's a problem, that a lack of a nutrient is the culprit.
Okay.
And yeah, if someone's iron deficient, that's bad. But how common does that deficiency cause thyroid disease?
Mm-hmm.
So the studies that I cited before about just diet reversing autoimmune thyroid disease, one of the studies took people who had overt hypothyroidism and Hashimoto's. They had average TSH scores of over 14. Many had very high antibodies, all had low T4 levels, nearly all were symptomatic. And all they did was have them lower their dietary iodine. Nothing else. They didn't make their diets healthier. They didn't check other nutrients. They didn't do gut health. That's all they did.
Oh,
And in
wow.
3 months, 78% of those people had perfectly healthy thyroid function. They didn't go on medication. They didn't sleep more. They didn't take selenium.
Wow.
They didn't take probiotics. They did nothing. All they did was lower their iodine intake. Now, 78% were totally cured in 3 months. That's cool. Of the remaining 22%, there was basically three groups.
Mm-hmm.
There was those who did it and didn't get better. There was those who didn't do it. There were those who weren't compliant. And then there was those to where they improved, but they didn't normalize. Their TSH scores were in the 3-digit range, 100, 200 greater. So if we rephrase that and say, how many who did it, either got totally cured or were heading that way, that was 97%.
Wow.
So nearly everyone who was actually doing it, that's all they did. They did nothing else. That's the only thing they did. So yeah, there's
Wow.
a million reasons to be healthy and everything you do matters. But in terms of thyroid health, people often think that there's 20 things you've got to do. 19 of those things might be important for your general health. But
Yeah.
this one thing has reversed thyroid disease for the vast majority of adults in controlled settings.
Wow. So basically what you're saying is iodine control for your specific needs is one of the most important factors for thyroid
Not
health.
not one of.
The most important.
It is. It is. And this has been
Wow.
written verbatim in many large meta-analysis that of the controllable
Okay.
factors, not only is iodine the most relevant, but it's more relevant than all the other factors combined. That's not my quote. That's a quote from other researchers.
Wow. That's fantastic. Okay. All right. I learned something new. Okay. Um, I feel that this last question is not even going to be of value. um, yeah. Okay. Okay. There's one question that I have, and this is mostly for the ladies. Men can fall in the category, but not as often. And this is I initially thought when I saw that thyroid disease is I think it's 70 times or 70% of thyroid disease is women. I can't remember
Auto,
if it was 70%.
so autoimmune thyroid disease in general, you'll see different numbers. You'll see them range between
Yeah.
about like sixfold to eightfold, but it's way more common in women than men.
Yeah. Okay. So I initially thought when I saw that, I thought, okay, well, what is the one thing that women have that men doesn't have as much of?
Yeah.
And I obviously decided it had to be estrogen. So does estrogen dominance or women who also suffer with anemia, does these two factors also contribute greatly when it comes to women's health?
Yes, they're big factors for women's health in general. So with thyroid disease, there's the main things that really cause disease and
Yeah.
can reverse it. And then there's things that can be worsening symptoms for someone who is on treatment otherwise. So someone needs medication. So yeah, if someone's anemic, that can actually cause unusual thyroid levels all by itself if
Yeah.
someone's anemic. Or if they need thyroid treatment, it can make their treatment not work as well, make their levels not stay as stable. Estrogen dominance is not really a defined term in the medical world,
Yes, I
but
know.
but yes, But yes, estrogen has a certain oppositional approach with the body's uptake of thyroid hormones via thyroid binding globulin. So if someone's estrogen status changes greatly, like during or after pregnancy, or going on or off hormone replacement or contraceptives, that changes thyroid binding globulin. And if someone is on thyroid medication and they need that, when their thyroid binding globulin levels are higher, which is associated with more estrogen, that may cause them to need more medication. So these things don't so much cause thyroid disease. They can certainly cause nuances of those with thyroid disease.
Okay.
Women with thyroid disease, there's three main reasons we think that why women get more of that. The third one relates to the androgen estrogen ratio and the binding globulins. The second one is from fetal microchimerism. So during pregnancy, a tiny number of foreign cells from the baby enter into mom. And that may be a factor triggering autoimmunity in general. But the one that's thought to be the biggest driver is just the fact that all the genes of thyroid disease, most of them are X-linked. And women have two sets of X chromosomes. So if they have some of these genetics, they don't have a chance of those genes staying dormant. They're more apt to be active.
Okay. All right. Okay. Well, yes. Okay. So I had a couple of questions and I think you've answered all of them. Is there anything that you would love to add and that you would like to educate the community who might not be familiar with your work, who might not be familiar with your books, on the work that you do, that can guide them and help them to how to start the process of healing?
Yeah, thyroid disease is common. It's very often underdiagnosed or badly diagnosed. Get your antibodies tested. That's often a bigger driver of symptoms than anything. Have an ultrasound done. Many have structural disease they don't know about. Don't go into the game of trying to micromanage your thyroid levels with medication. It's a fool's errand. Symptoms may do better short term, not in a lasting sense. Medications have side effects. If you need them because you lack a thyroid, that's worth it. Otherwise, the medications have more harm to offer than benefit. Now, the cool thing is that nearly all people can improve their thyroid function, even if they're put on thyroid medications unnecessarily. So yeah, that's something that after 30 years of doing work in this field, I just become more and more convinced and see more examples of the body being able to fix itself. Take a look at the thyroid reset diet, follow my work. I share lots of information about how you can know if you need medication, what to do if you're on it, and how you can heal your thyroid naturally.
Okay. Do you have some books available that you can maybe just show the people? If you have them with you or close by you, then you can just show the community what they can look for online.
That's the best one to start with, is the thyroid reset diet.
Fantastic. Fantastic. So yes, I'm going to definitely get myself one of those as well. And because, I mean, if I ever get a client or so that has struggles, I can know where to start and how to refer them to your work. And does this book, it contains recipes as well. Fantastic. This is fantastic. Thank you so much. Dr. C, you've been amazing. Thank you so much for sharing your knowledge and your experience. And one last thing, do you have any last words of encouragement for anybody that is on this journey and looking for answers?
Broader than thyroid overall, health in general, in nearly all cases, there's things you can do. And I don't have the answers for things outside of thyroid care, but others do. And I'm glad that you're here for people as a resource. Follow this channel here and keep learning and don't give up. Keep educating yourself and reach out and share things that help. But yeah, don't give up. The body can do amazing stuff when it gets a chance.
Fantastic. Dr. C, thank you so very much for your time and sharing all your knowledge with us. It's really greatly appreciated. Everybody, please go and follow Dr. C's work and buy his books, invest in yourself. There's always answers and there's hope for healing. Make 2025 your year of restoration and of healing. Thank you so much. Have a wonderful evening, everybody.
Beautiful.
Good night.
Thanks for having me. Bye-bye.
Thank you. Bye-bye.